Hi, this is Eric Ruderman from Northwestern University in Chicago, coming to you from the EULAR meeting in Milan with some information for Room Now on psoriatic arthritis. I took a look at some of the psoriatic arthritis abstracts in the meeting this year, and while there wasn't a lot of new clinical trial data, and particularly new data on additional treatment options, there was some interesting data on sort of a relook at some older trials. And one that I found particularly interesting was a reanalysis of the DISCOVER trials, which were the pivotal trials for the use of guselkumab in psoriatic arthritis. The DISCOVER 1 and 2 trials basically randomized patients to 100 milligrams of guselkumab versus placebo. Primary outcomes from these trials have been discussed previously. This particular analysis looks specifically at enthesitis. And the backstory on this is that we've seen some data in the past looking at polyarticular versus oligoarticular psoriatic arthritis. And although the sort of initial sense is that, well, maybe oligoarticular arthritis is less impactful, it really depends on which joints are involved. And some of that work suggested that if the joints involved were a particularly inflamed wrist or a knee, that was going to be much more impactful in terms of function and impact on daily life than a bunch of DIP joints, for example. This particular analysis in this abstract, which was abstract poster number 27 at the EULAR meeting, looked at enthesitis with that same kind of lens. And they looked at the enthesial inflammation or enthesial tenderness in these DISCOVER trials. And the question they asked was, typically when we measure enthesitis in clinical trials, it really just sums up the number of enthesitis tender points, the number of enthesial insertions that are potentially active. This asks a different question: which specific entheses were active, and what was the impact of those entheses on sort of overall function? And the main thing they found was, not surprisingly, the most common enthesis involved in psoriatic arthritis in these trials was the Achilles tendon insertion. But what was really important is that inflammation or tenderness or activity at the Achilles tendon insertion had the greatest impact on patient-reported outcomes, including pain, global assessment, and function as measured by the HAQ score. Other entheses, such as the lateral epicondyle, less impactful. So I think, in the past, we've sort of looked at entheses scores from clinical trials and try to decide whether one drug is better than another drug because of how many patients do we reduce the number of tender entheses or eliminate them. And I think the take home from this is it may very much depend on which entheses are involved. And it's something we need to think about, I think, in our practice, and recognize that you can't just sort of look at the overall number, but often you have to really think about where patients have their pain, have their tenderness, and how that's going to impact their lives. So it was a bit eye-opening, and I think it's useful information that we may want to see going forward into additional trials, because it may be a more useful way to look at the impact of different treatments on enthesial pain. Stay tuned for more information from Room Now in the coming days, and thanks for listening.